Hi everyone, welcome back to the channel. Today's video is going to cover a fascinating topic, and it is, does gum disease cause breathing problems? We will use new 2025 studies to explore this question. As always, there is way more to the story than meets the eye. Let's dive into the science together. Here are some highlights from our discussion today. First, several new studies in 2025 have provided compelling evidence that chronic inflammation from gum disease, especially if driven by pathogenic microbes, may compromise lung health. Second, oral microbial dysbiosis seems to not only worsen chronic lung diseases like COPD, but also may initiate lung diseases like COPD, especially in smokers or older adults. Third, non-surgical periodontal therapy can help restore normal airway resistance, suggesting benefits beyond just alveolar function. And finally, integrated dental and respiratory screenings may be warranted for at-risk patients. Before we continue, please consider subscribing to the channel if you enjoy learning about the latest medical science. And remember, you can always review our references in the description below. First, let's start with the basics. What does the term gum disease refer to? Gum disease, or periodontitis, is an infectious inflammatory disease primarily affecting the gums, but it has systemic implications. Caused by dysbiotic oral microbes, it leads to progressive periodontal tissue destruction if left untreated. Several studies in 2025 have shed light on the intricate connection between oral and respiratory health. How do they communicate with each other? They communicate via the oral-lung axis. Herein, periodontal pathogens like Porphyromonas gingivalis and Fusobacterium nucleatum may be aspirated into the lower airways. So what happens when these oral pathogens reach the lungs? Once in the lungs, they can colonize the respiratory epithelium and trigger localized inflammation. This response involves immune cell recruitment and the release of pro-inflammatory mediators. The ensuing immune activation contributes to tissue remodeling and functional decline characteristic of chronic respiratory diseases. This bidirectional communication between oral and respiratory systems is mediated by microbial products, immune cells, and soluble factors. For example, soluble factors such as cytokines play a crucial role in this interplay. One study in 2025 found that serum levels of interleukin-17 IL-17 were significantly elevated in patients with both chronic obstructive pulmonary disease, COPD, and periodontitis compared to those with COPD alone. Elevated IL-17 levels were also associated with more severe lung function decline over time. Furthermore, another study revealed that patients with severe periodontitis had higher levels of inflammatory markers such as C-reactive protein CARP and serum amyloid ASA compared to healthy individuals. These systemic inflammatory markers reflect the body's response to periodontal pathogens and their products, which can also affect respiratory health. How does the oral microbiome influence respiratory health? The oral microbiome plays a critical role in maintaining overall health, including respiratory health. Recent research in 2025 indicates that alterations in the composition and diversity of the oral microbiome, referred to as oral dysbiosis, can significantly impact respiratory function and disease susceptibility. Studies have shown that individuals with COPD often exhibit distinct oral microbial signatures compared to healthy individuals. These differences include an increased abundance of certain bacteria such as Streptococcus, Haemophilus, and Veillonella species in COPD patients. Moreover, alterations in the diversity and richness of the oral microbiome have been associated with COPD severity and exacerbations. For instance, a study found that patients with more severe COPD had reduced oral microbial diversity compared to those with less severe disease. Additionally, changes in the oral microbiome have been linked to the development and progression of other respiratory conditions like asthma, pulmonary fibrosis, and pneumonia. For example, individuals with asthma often display higher levels of oral inflammation, and specific bacterial taxa like Streptococcus and Prevotella have been associated with asthma severity. Similarly, alterations in the oral microbiome have been implicated in the pathogenesis of pulmonary fibrosis and pneumonia. Second, what are the links between periodontal disease and breathing problems like COPD? COPD is a chronic respiratory disease characterized by airflow limitation that is not fully reversible. It is commonly caused by long-term exposure to irritants like tobacco smoke or occupational chemicals. However, recent research suggests that factors beyond traditional risk factors may contribute to its development. Emerging evidence points to a strong association between periodontal disease and COPD. Several studies have examined the relationship between periodontal disease and COPD risk. One large-scale study found that individuals with a history of periodontal disease had an increased risk of developing COPD. Furthermore, another study revealed that the presence of periodontal pathogens such as P. gingivalis and F. nucleatum was more common in COPD patients compared to healthy individuals. The underlying mechanism connecting periodontal disease and COPD involves the concept of microbial translocation. This process refers to the movement of bacteria or their components from the oral cavity into the bloodstream. In periodontal disease, chronic inflammation and tissue destruction at the gum line can facilitate the entry of these microbes into the circulation. Once in the bloodstream, they can be transported to the lungs where they can colonize the airways and contribute to inflammation and tissue damage. Moreover, host immune responses to periodontal pathogens also play a role in this process. For example, immune activation and subsequent inflammation can lead to an influx of immune cells into the lungs. This influx of immune cells can contribute to the development and progression of COPD. Additionally, oxidative stress and systemic inflammation associated with periodontal disease can also influence respiratory health. Third, what does the current literature say about the effect of periodontal therapy on lung function? Non-surgical periodontal therapy encompasses various approaches aimed at controlling biofilm, reducing inflammation, and eliminating periodontal pathogens. It typically involves a combination of mechanical plaque removal through procedures like scaling and root planing along with adjunctive therapies such as antimicrobial agents. So, what does the current literature say about the effect of periodontal therapy on lung function? A longitudinal cohort study published recently followed 89 healthy participants for 1 year. Researchers assessed changes in airway resistance and reactance using oscillometry before and after periodontal treatment. The results showed significant improvements in airway resistance and reactance following periodontal therapy. Specifically, participants demonstrated an average reduction of 16.5% in airway resistance and an increase of 40% in reactance after periodontal intervention. These findings suggest that periodontal therapy can positively impact lung function and airway properties even in the absence of overt spirometric changes. The improvements in airway resistance and reactance indicate enhanced airway caliber and dynamic compliance, respectively. This may be attributed to the reduction in systemic inflammation and oxidative stress following periodontal treatment, leading to improved lung function. These findings align with previous studies demonstrating the efficacy of periodontal therapy in reducing systemic inflammation and oxidative stress. By targeting periodontal pathogens and reducing inflammation, periodontal therapy may indirectly benefit respiratory health. Finally, what gaps remain in our understanding of this complex relationship? Despite significant progress in unraveling the link between gum disease and breathing problems, several gaps remain in our understanding. One notable gap lies in the precise mechanisms by which periodontal pathogens exert their influence on lung function and disease pathogenesis. While microbial translocation and immune activation are implicated, further research is needed to elucidate the specific pathways involved. Another area that requires further investigation is the role of host genetic factors and comorbidities in modulating the relationship between gum disease and respiratory health. Understanding the interplay between genetics, oral microbes, and environmental factors could provide valuable insights into disease susceptibility and progression. Moreover, longitudinal studies with larger sample sizes are necessary to establish the temporal relationship between periodontal disease and respiratory outcomes. Such studies would help clarify whether periodontal disease precedes or follows the onset of respiratory conditions and aid in risk stratification. Finally, while the evidence linking gum disease to breathing problems is compelling, establishing causality remains a challenge. Randomized controlled trials directly manipulating periodontal health in individuals with respiratory conditions would provide the strongest evidence for causality and inform effective preventive strategies. In conclusion, accumulating evidence in 2025 underscores a robust oral respiratory axis, dysbiotic oral environments, and periodontal inflammation can impair lung function, contribute to COPD progression, exacerbate pulmonary fibrosis, and heighten infection risks. Conversely, restoring oral eubiosis and periodontal health may offer a promising avenue to support respiratory system resilience. Integration of dental hygiene and periodontal care into respiratory health strategies holds potential for improving patient outcomes. Further research should focus on unraveling mechanistic insights, establishing causality, and informing tailored preventive and therapeutic strategies around the oral lung axis. Thanks so much for watching. Take care and stay healthy.